journalist who's currently in Afghanistan, and she will give us her sense of conversations she's been having with the Taliban government around education, for girls. So we'll talk about that. Do not miss that coming up pretty shortly. But for now, well, we don't have a national state of disaster any longer. Interesting one indeed. What do you make of that? With me, Dr. Angelique Coetzee from the South African Medical Association. Dr. Coetzee, I appreciate your time. Good morning.
Good morning, and a good morning to all your listeners out there.
Thank you. So here's the thought, right? I'm going to suggest, as the layperson on the outside, that the implementation of the national state of disaster in the first instance was there to either eradicate or more accurately to limit the expansion of COVID-19 at that time, right? All things considered, 750 days later, do you think that the government's got it right in terms of why it was implemented?
Very good question. If I can, with hindsight, look back, I would like to say that 160 days were too long. It should have been stopped before. And if we look at level 5, there was a lot of irrational decisions on that. Secondly, if we look at the numbers of COVID that we are currently seeing, we still see a lot of patients that's positive, but it is not a problem on the healthcare system. And that was actually what the government used later on to say we should take off the burden on the healthcare. We need to get prepared and get them ready. And we saw during Delta that even there was not enough preparation done. So for now, since Omicron started, we should have moved out of this.
Okay, interesting. So you suggested, firstly, it went on too long. So when should it have ended, according to you?
If you look at the readiness of the burden on the healthcare system. With Delta, there was not really. There was a severe. There was a severe burden on the healthcare systems. So the preparation didn't prepare us actually very well for that. But after that, when we moved into Omicron, we kept on saying it's a mild disease for the majority of people. And there, we should have already started to move into out of this disaster management. So if you also look at the level 1 regulations that's been implemented, not a lot changed since Omicron started.
Yeah, I think that's a fair point. The other part, and you're quite right, you've said it a few times about, in fact, the national state of disaster was set up because of a fear that if everybody got infected at the same time, the medical authorities just cannot cope. So the idea is to delay infection so that you are able to cope, right? And you're saying, certainly with regard to Delta, we didn't get it right. With regard to Omicron, it was okay because it was less severe. So far less people actually went up to hospitals itself, right? So therefore, picking up from your very first point, you suggested we got a lot of things wrong. What did we get wrong?
Well, especially under level 5, by totally bringing the economy to a standstill for quite a period of time. That didn't make any sense to us. And then what we also saw is the corruption and the inability of a lot of the hospitals, public sector systems, not being able to even cope with influx of patients other than COVID. Also, it's not a ban, but to advise people not to go to their clinics to get treatment for their HIV or their TB or any of that. It put us back with chronic diseases. We're going to see, and we see them currently, an uptake in chronic disease complications. And then all the nursing staff that's been used to try to help with the vaccinations, as well as in the hospitals, totally being taken out of the context where they serve the community, go out to houses and homes. That's why there's an increase in malnutrition, especially in the Eastern Cape.
And that we shall see, it's going to get less media attention, and maybe is not, it doesn't drive the news agenda, but it's certainly something that we may see a lot more down the line. Therefore, in terms of the ending of the national state of disaster last night, the responsibility, according to the president now, would be left to the health authorities, right? Are you confident in terms of where you sit with South African Medical Association that the medical or the health authorities will be able to take on the responsibility? Because I take it will start with the Department of Health, isn't it?
Well, you only need to look at the track record. And if you look at the track record, do you think the National Department of Health would be able to deal with this? I don't think so. And the other thing, if you listen to our vaccine, the amount of people that's being vaccinated, 44% of adults fully vaccinated, it took us 14 months to get that right. Is that something that we can be proud of? I don't think so.
So in the light of that, in the light of your I don't think so, then what now, Angelique?
Well, if I look at what is happening again, the responsibility is not really given to the Department of Health. It is given to instances where people are gathered, big gatherings of people are coming together. They have now to make sure that the people are vaccinated. Or if you look at schools, the 1 meter is also being taken away, if I'm not mistaken. So I want to say, what is the responsibility of the National Department of Health and the current government, especially around sanitation and ventilation in schools, public buildings? There are still schools with no running water. We still need to wash their hands. What is that? What responsibility is that?
Well, you've asked us you've left us with some very important questions on this one. If I then go back to the outset, do you agree that in its initial implementation, the national state of disaster was the correct approach? I'm not talking about the corruption that came. I mean, those are individuals, but the actual plan and the why around the initial implementation. Do you think that was right?
Well, if you look back, we didn't have any experience. So yes, if you look at the level 5, but some of the like banning food, not to sell food, open shoes, sandals wearing, stopping cigarettes and that type of thing. That's madness. There's no evidence on that. So the moment when they noticed that was not a good regulation that you brought into play, they should have stopped that.
Yeah, I must say there's a whole discussion about some of the most ridiculous rules that were implemented, including I think you could get long sleeve t-shirts, but you couldn't buy short sleeve t-shirts for some reason. I don't know, whatever that was. But that's another whole conversation, right? Moving forward, there's also been two things. One is the secondary view that in fact this entire prolonged national state of disaster not only harmed the economy, which I think we all agree on that, but also was an attempt by governments to force control people. So for 750 days, they were in a position to remove our civil liberties. I know where you sit from the medical side, but what do you see? I mean, do you agree with that?
It was definitely control. If you look at the Command Council, which not medical background people, it's more political. They've been advised by the advisory committees from National Department of Health on the health aspect, and some of those regulations were ignored. or advice.
Okay,
Not
so
necessarily
moving
recommendations,
forward
but,
now, two other concerns. One is what happens if there's a rise in COVID-19, with one of the new viruses that have come online. What will happen then?
well, I think if you read carefully what the president said, he alluded to the fact that we can go back to a national state of disaster. And it all depends what type of variant we were getting, how severe the disease is, and what's happening on the healthcare. Remember, we are seeing patients with positive COVID who had been vaccinated, fully vaccinated, had COVID before, fully vaccinated and COVID before, with the cutoff date that we are currently seeing around about September. And that's going to 6 months from now on. It means that if you have not been vaccinated with a booster, less than 6 months, you might get again COVID infections, especially if the new variants escape your immune system, as we currently see. So even our vaccine boosters are lacking that escaping component to control the viral infections.
And just lastly on that, I understand, I don't have the numbers with me. There are many of the multinationals who provide vaccines like Pfizer and the others. I understand that some of them are expired or expiring any day now. They literally have to be removed out of the country because they are pretty useless. Your thoughts on that part?
Well, again, if you that brings me back to only 44% of adults fully vaccinated after 14 months. So there's something wrong with your vaccine program. You don't get the uptake that you want to. And 62% of adults above the age of 50 who has been fully vaccinated, also a problem. We saw that in Hong Kong, that, people who are predominantly older, who got COVID recently, it's now, it happened now, had a huge hospitalization uptake as well as death. So we cannot sit back and say, 62% about 50 years of age fully vaccinated, and then we send vaccines away because they're going to expire. And also remember, the doctors, the family practitioners, has not been brought into vaccination facilities and given us the ability to apply on the facility masters list.
Which many have said, why not? I agree. So lastly, Dr. Coetzee, what's the one unanswered question that you'd like to put to either the President or the Minister of Health?
My question would be, how sure are you that your vaccines and your natural immunity is still going to last 9 months from now on?
Okay, let's see who can answer that. I don't know. Appreciate your time, Dr. Angelique Coetzee. Fascinating insight in terms of where she sits with the South African Medical Association with regards to the fact that the national state of disaster is no more, 750 days later. Now, what about your opinions? You can post comments on any of the social media pages of Salam Media, but also you can call in live 011 680 0355 or WhatsApp voice note or text 061 766 0355. I'll get Rahima to check up the voice notes if and when they come, because I certainly would like to play them. Yvonne Ridley comes up next.